of the Health and Community Committee, which will be a hybrid meeting conducted remotely via WebEx and physically in the Council Chamber, Guildhall, on Wednesday, the 1st of June 2022 at 4 p.m. I commence just firstly with the attendance. So Alderman Devaney.
Here, Karen.
Alderman Guy.
Here, Karen.
Alderman Kerrigan.
Here, Karen.
Councillor Michaela Boyd.
Shaw here, Karen.
Councillor Carr. Councillor Carr. Councillor Duffy. Councillor Edwards. Councillor Farrell.
Yep, here in the chamber.
Councillor Ferguson. Councillor Fleming. Councillor Harkin. Councillor McGinley.
And Shaw, Karen, I'm online just there.
Councillor Sonoya Barr. And Councillor Cheney.
Here, Karen.
Thank you. Okay. Can I just do a further check then? Councillor Harkin. Councillor Carr. Councillor Duffy. And Councillor Edwards. Okay, thank you.
Thank you, Karen, and welcome to members and officers to today's special health and community meeting. And we have two very important presentations which we'll come to, but if I could first read out the broadcast announcement. I would like to remind everyone present at this meeting in the Guildhall or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council privacy notice may be found on the Council website, www.derrystrabane.com. Just members at this juncture, if anybody has any declarations of interest to declare either now or as the meeting progresses. And as I say, members, two very important presentations. And the first one on your behalf, could I welcome from the Women's Resource and Development Agency, Rachel Powell, and Elaine Crowley, and invite them to address the committee. And just to say to yourselves, Rachel and Elaine, thank you for all of the documentation and the information that was sent through, and we look forward to your presentation. And then I will obviously invite members of the committee and other elected representatives to come in on the back of that and then come back to yourselves if that's okay. So welcome Elaine and Rachel.
Thank you very much. I'm going to let Rachel begin the presentation.
Yes, so I'm not sure who's actually sharing those slides, but hopefully if I just say next slide that we'll be able to move on each time. But thank you so much to the Council for having us here today, and thank you as well for the special motion that you passed in relation to the work of the Women's Policy Group, specifically in relation to our Feminist Recovery Plan and also our Violence Against Women and Girls research. So we're going to give a summary of these findings today and outline some of the key recommendations from both our Violence Against Women and Girls research and the Feminist Recovery Plan. So next slide, please.
So this first part relates to research that we did when we were putting together our response to a call for views that went out from the Executive Office. And this call for views was looking at a violence against women and girls strategy, which we've never had in Northern Ireland before and which we called for a long time. So while we were doing that, we had a great deal of work we had previously done to call upon, but we thought that it would be valuable also to open out to the public for views. So we set up an anonymous online survey, and one individual interview that came from that because somebody contacted us wanting to share their experience. In that survey, we asked a mixture of questions, both qualitative, such as, ones you can measure with numbers, and quantitative, so people could tell little bits of their stories. Some of those questions were mandatory so that we could get some demographic information. Some of them were optional due to the fact that they were quite sensitive. They were built on, we came up with these questions looking at the primary research we had done back in 2021. And this was open for 25 days only between the 20th of January and the 14th of February. Despite that only being open for 25 days, we had 1,065 responses, which was really indicative to us that people really, really wanted to have their voices heard in this strategy that's coming out. So next slide.
Thank you, Elaine. So just to give you a bit of context on the backgrounds of people that responded, we specifically wanted to understand the demographics and to make sure that we were engaging with women that would face additional levels of marginalisation. And just to say, we did specifically arrange for this to be with women and girls and their experiences. In the past, we've had surveys that were also open to men and boys. But in this instance, we were trying to form our submission to the Executive Office as the women's policy group. So we decided to focus specifically on that. But if you look at identity and background, 13.3% were from an LGBT background, 9.9% were disabled, 3% were migrants. Over half of all respondents were from a working class background. Almost a quarter from a rural area, just a few didn't want to say, and a quarter were none of the above. In terms of age as well, we did get a good mix across all of the age groups, but with the biggest responses coming from 40 to 49 years old. But we did very much work with youth groups, older groups, and more to try and push up these responses. So next slide, please.
So we also wanted a picture of what kind of ethnic background people had. And this was primarily, we always put out an option for people not to say or not to choose one way or the other. But this was so that we could see whether or not we were capturing particularly minorities within this community, and if so, which minorities were we able to get information from and which were we not. Now, there was a sort of a breakdown really between just over half identified as Irish, about just under a quarter as British, about 15% as Northern Irish. And then some people as other, either because they're from different backgrounds or because they didn't feel comfortable choosing just one of those options. Then we had in ethnicity, we had about 95.4% white people. Now, this is not hugely surprising because we are an overwhelmingly white population. But if you look at the little bullet points below, you can see such a range of different nationalities and different ethnic groups that made up the remaining nearly 5%. So it really is quite a wide range of people. The one thing we don't have is any Irish travellers, and that's an issue in general that we need to forge better links with the Irish traveller community so that people feel more, I suppose, comfortable engaging with us on this. We become a trusted, I suppose, conduit for them to seek to put their views through on. And in terms of religion, there's a mix there as well, with quite a large percentage, 32.7, the second biggest percentage, saying that they don't have any religion at all. But yes, those are the demographics of nationality, ethnicity, and religion. Next slide, please. Sorry.
So within the report that we did send on, we go through each of the questions that we asked in detail and the responses that we found. But for the purpose of this presentation, we thought it would be useful to just summarize these as briefly as we can. But when we asked women whether they had experienced men's violence, if you look specifically at these areas of additional marginalisation, almost 95% of those women from the LGBT background had experienced men's violence. 92.4% of disabled women 78.8% of migrant women, 87.7% of working class women, and 84.7% of those from a rural area. Now, overwhelmingly, when we asked women, it was over 80% had been directly impacted by men's violence within their lives, but we will come to that in more detail. But it is clear from looking at this that LGBT, disabled, working class and rural women are at a higher disadvantage or at more risk of men's violence. Next slide, please.
So here are just some highlight key findings, and they continue on the next page. So we have about 91.2% of women who responded think that Northern Ireland has a problem with men's violence against women and girls. And they specifically, we chose that phrasing specifically because we wanted to ask people, where is this violence coming from? It isn't just violence that happens. It's not just like bad weather. Somebody is doing it. So we wanted to capture that. 97.2% think Northern Ireland should have a strategy, which now we believe we're going to get. It might be held up by the lack of an assembly, but hopefully it'll be coming whenever that is reinvigorated. 83% of women have been impacted by men's violence against women and girls, but only 21.4% of those 83% reported this to the police. And that's really, really, really telling. Again and again, you can see incidents where people have clearly identified that they have been the victim of what would count as a crime, but they have not, for various reasons, reported it to the police. And we'll be coming back to that later on. 77.4% of those 21.4 who did report it did not find reporting it useful. So this is part of the reason that fuels people not reporting, because they hear from their sisters, their friends, their mothers, I did report and I kind of wish I hadn't. So there's evidence there of a serious issue. 89.7% of women believe that Northern Ireland has a problem with attitudes of sexism and misogyny. And of course, it's those attitudes that fuel this epidemic of violence. Not every person who holds those views will commit the violence, but they sort of give cover to those other people who do. And then 80.8% of women believe Northern Ireland has a problem with rape myths and rape culture. And rape myths specifically refer to false beliefs that we have about who's responsible for sexual violence. And we tend to apportion some of that blame to the person who commits the violence and some of it to the victim. And those are often things like the way people dress, what people drink, where they go, and so on. But it's also things like people making up stories. That itself is a rape myth. And rape culture is the culture that allows and turns a blind eye to sexual violence. And then 87.4% of women believe that Northern Ireland has a problem with victim blaming. And those are all of those myths that apportion blame, but also that we inflict this even on ourselves when we are victims, which also contributes to people not reporting to police because they believe on some level it was partially their fault. Next slide, please.
So to summarise some of the rest of our key findings then, 81.2% of women believe there's a stigma surrounding issues of violence against women and girls. 92.3% believe that there are barriers to reporting this violence. And 95.2% believe that in order to reduce levels of violence against women and girls, the focus should be on men and boys' behaviour and actions. And this is really important because up to now, a lot of the campaigns to deal with these sort of issues have focused on things like blaming women for how much they drink or what they wear, or telling them not to go out at night, as was seen after a man stabbed 5 women in Belfast about 18 months ago. Women were told not to leave the house. You know, these are the sort of things that are not helping and clearly need to change. 78.6% believe that women believe that additional action is needed to address men's violence against marginalised groups of women. And this is specifically where we included trans women, disabled women, rural women, migrant women, and more. In addition, 86.8% believe that there needs to be a review of the justice system and how the justice system treats victims and survivors of men's violence against women and girls. And we did get a lot of responses in relation to this in the written questions, which we will come to in a bit more detail, or is in the report in a lot more detail. And as well as the 83.4% believe that state violence against women and girls should be included within this strategy. And specifically then, in response to this question, women highlighted again and again issues like the mother and home institutions or the Magdalene laundries, or denying access to abortion, or enabling abuse of women outside of reproductive healthcare centres or hospitals as the exact examples that they wanted to be included within this strategy. Next slide, please.
So when we then asked what should we include underneath these this heading, this umbrella of violence against women and girls, because it is such a broad term that sometimes people interpret it as being talking specifically about violence from strangers outside of the home. And then other people interpret it as being entirely about domestic abuse. It's all of those things, and it's much more. So we gave a long list of things, and people could click as many as they wanted. And 95.8% of those women think that we should address all of the following forms of violence. Some of them are widely known and appreciated, such as domestic abuse, sexual abuse, but other ones are relatively unheard of or not really considered with the weight that they should, such as online abuse, honor-based abuse, sexual harassment and street harassment, emotional abuse, either within a domestic relationship or in one where you don't share a home with the person, forced isolation from family and friends, which of course can be a tactic of domestic abuse, controlling a person's individual style and appearance, again, it's part of that coercive control, systemic violence by the state, and we were including in that even policies that, such as a 2-child tax credit cap, that I suppose inflict control on women's bodies and so on. We also included things that are currently not necessarily crimes, such as unwanted rough sex, which really our justice system hasn't quite grappled with that yet, because it's very difficult to put a name on it or to criminalize it. And very often people are experiencing it and not knowing where to turn afterwards for help. Misogynistic hate crimes, still at the moment we don't have a statutory aggravator for misogyny. This council did support a motion brought by Raise Your Voice a number of years ago, I think 2 years ago now, on this. We are still working with the justice system to get that in. Also things like spiritual abuse, workplace harassment, including sexual harassment, stalking, which we've now finally got a law on, economic abuse and coercive control. And that's such a wide variety of different things. And those are the things that were supported by 95.8% of the women who responded. So next slide, please.
So we did ask women, are you aware of the below forms of violence against women and girls? And you could see that it absolutely did vary. So while they did support all of them being within the strategy, some of the areas, particularly things like honor-based abuse and spiritual abuse and systemic violence by the state, was areas that they believe people needed more awareness on. And specifically within honor-based abuse in the context of Northern Ireland, we have been raising this as something, this is recorded across the rest of the UK by the police, but it's not really recorded in Northern Ireland because there's this false assumption that it only happens to Muslim women. But really, it's actually around coercive control of communities. And a lot of the actions against women by paramilitary groups across Northern Ireland can be accounted for as a form of honour-based abuse. So that's just to give an idea of how much people clearly did know about, but over half of those were fully aware of all of the above. Next slide, please.
So then we asked a question that has been, very little data has been collected on this specific to Northern Ireland. We do have UK-wide data, but we had a sort of inkling that perhaps in Northern Ireland people experience violence or are impacted by violence against women and girls, which can include, of course, being within a family where somebody else is being abused and you're aware of it. But we wanted to know what age people were when they first experienced this violence, and specifically because we suspected it might be younger here than the average. And indeed, 82% of respondents first experienced violence against women and girls before the age of 20. Now, that's just the first experience. That's not to say it's by any means the last. We do have some, from very young childhood, but you see that the largest bar, 33.9% experienced men's violence before they turned 15. So that's really, really telling. Around the time of puberty is where you see this explosion of numbers. And that kind of chimes with what we know elsewhere. And it does seem to be even younger and younger average here than elsewhere, and partially because we have a society in which this kind of violence and misogyny in general is taken less seriously perhaps than some other places. Next slide, please.
So just to say as well, within the report, you'll be able to read the first-hand testimonies that hundreds of women shared about their first experiences of violence, and the overwhelming theme across all of them was that it didn't happen to anyone just once. It started at a young age but continued throughout their lives. But specifically to say as well in relation to what places should be included in a strategy to tackle violence against women and girls, this is particularly relevant to councils. So they talked about domestic settings, public spaces, workplaces, educational institutions, religious settings, sports and leisure places, community settings, and then online. So over 90% for absolutely every one of those. And I think there is a real duty, regardless of what happens with the executive office strategy, for this to be fully embedded and implemented across every local council. And that is the sort of thing that, you know, the Women's Policy Group and Raise Your Voice are more than happy to work with councils on doing. But it is clear that this is what women want in relation to dealing with the issue. And particularly as public spaces received the most responses from women of where they were experiencing violence or harassment. Next slide, please.
So we then asked, and this was in a free text box where people could write really whatever they wanted. Is there anything else that you would like to share that you think we should be calling for within the violence against women and girls strategy? Because, you know, as much as we sat down and kind of brainstormed these lists, there might be things that we haven't thought of or have missed. There's always new forms of violence. The one thing about violence is it constantly evolves to find new ways to express itself. So some of the suggestions there, you see them in little speech bubbles. You can see things like focusing on preventative rather than reactive measures. And that is something that we really, really want to see in this strategy. The reactive measures deal with things like the justice system, how we deal with perpetrators, and also services for survivors. And those are both vitally important. But ideally, we should be trying to reduce the numbers of incidents in the first place. People have mentioned specifically addressing state violence, more education to address the patriarchal culture, and that is one method of preventative measure, not the only one, but one. We've got addressing interrelated forms of violence, because so often in that big long list that you see of different forms of violence, you see an overlap. So a person who is perhaps controlling their partner will use several different methods within that, I suppose, arsenal of methods to control that person. We've got reform school curriculums. This is something we've been working on for a long time with Raise Your Voice, about improving the way we talk about relationships and sexuality education to deal with consent better, but also to model healthy relationships so that people can be aware of the red flags and so that people can know when to reach out for help. Stronger punishment for perpetrators is a suggestion. Funding for women's support services. There's a desperate lack of funding in the system right now for things like women's aid, rape crisis. We don't have any walk-in centres. We've got one treatment centre in the whole of the north. It's in County Antrim. It's very inaccessible for somebody within a controlling relationship in, let's say, rural Fermanagh. It's just not at the same level as it is in other parts of these two islands, and that's really not acceptable. Stronger equality legislation, and that's again preventative method, another one. Accessible abortion provision, and that is as much as people might think that that looks a little bit out of sync, it's really not, because it speaks to state violence, but also it speaks to the services that we offer to survivors and how they move on with their lives, especially if they end up with an unwanted pregnancy from men's violence. And then ensuring the strategy is resourced, that means money, and leads to actual concrete actions. And this is really, really important to us. We wanted to make sure that the strategy, however, whatever's in it, is not just a document that sits on people's shelves so they can say, look, we did the thing that we said we would do, and it's there. And it all it's done is really collect some vague ideas. It has to actually result in concrete actions. So next slide, please.
So just to say then, that was a very quick summary of what was just a huge amount of data from over 1,000 women. The report that we did send on, which I know was sent out in your packs, goes into much more detail on all of that. We are going to be having a formal launch event of the research on Thursday, the 30th of June in the Assembly. but we are more than happy to engage with all councils about different aspects of the report and really what can be embedded within each district area. But now we're just going to very quickly wrap up by summarising the Feminist Recovery Plan, because aside from this violence against women and girls research, this is by far the biggest piece of work that we've ever done. And the Feminist Recovery Plan is something that we developed several years ago now. It was written by 35 policy experts across 26 different organisations. And basically, you know, from the beginning of the pandemic, we decided that we needed to launch a Feminist Recovery Plan, because within the first couple of weeks alone of the lockdowns, we were seeing things like domestic violence skyrocket, or women losing access to maternity pay when they're being furloughed, or PPE not fitting women. And we thought, you know, if that's happened already with these things, surely this is a much broader issue. So we decided then that we were going to analyse all of the issues across all of society in Northern Ireland, find the evidence of how women were being impacted, and make policy recommendations. And I did send on a later version, which is specific to local councils. It's a summary version. But basically, we launched this due to the ongoing prevalence of gender neutral or gender blind policy making in Northern Ireland. We're one of the only parts in Europe that does not have any specific legislation to support women in a whole range of different areas. The pandemic as well also had a completely disproportionate impact on women, and we found that government was very reluctant to engage with the women's sector or acknowledge the gendered impact of the pandemic. But from the outset, it was clear that this was a gendered pandemic. 79% of all health and social care workers in Northern Ireland are women. 82% of part-time workers are women. They were primarily making up a lot of the sectors that either were working on the front lines or were furloughed and closed for very long extended periods of time. 70% of all workers ineligible for statutory sick pay are women. 69% of all carers, paid and unpaid, are women, and 91% of single parents are women. And this is something that has exacerbated greatly now in relation to the cost of living crisis, which we did predict would happen within this plan if action wasn't taken. And as we've already mentioned, women account for the vast majority of domestic abuse victims. So that's really just some of the key points of what was going on and why we decided to do this plan. So next slide, please.
So this is a sort of timeline to outline what we did with this recovery plan. So obviously the lockdowns and the pandemic, I suppose the pandemic began well before March 2020, but this is when it really hit home for us here in the north, and that's when the first lockdown took place, March 2020. We published the Feminist Recovery Plan in July of 2020, so it was pretty quickly. And for that reason, we were scrabbling around quite frantically really for data. We had loads of data from before that because we had been working away on a lot of these issues for a long time, and we were gathering them together, but it was still stuff specific to the pandemic that we could not get fresh data on. And we had to try and create, or not create it, but find it. And then we began a sort of engagement plan to get the details of our plan out there into the world. We dealt with political parties and the media and the community. So a lot of what we did was designed to reach out to people and tell them, here's what we have, and here's what we've got under each sort of heading, if you will. And we had themed, you can see a picture there, the third one over. It shows just a screenshot of lots and lots of people attending a webinar, and those webinars went on for, I think it was over a year, and they would be on once a month covering a specific area. So we had one, for example, about violence against women, but we also had ones about, for example, economic issues, budgetary issues and austerity and so on. So there were themed ones, and we had experts come on and speak and present it. Then between May and June of 2021, we had collected data. Now, remember I said we had lacked data the previous year. Because we decided we were going to rejuvenate the Feminist Recovery Plan and relaunch a newer version 1 year on, we went out there to collect some of that data that we couldn't find the first time out. So we carried our primary research. Again, it was anonymous surveys and then follow-up interviews that were all anonymized. And that was in the summer of 2021 in preparation for the relaunch of a revamped plan with more detail, more data, and more first-person experiences. And that was relaunched in July of 2021. And that came along with the same sort of engagement as the previous one. So reaching out to the political parties, the media, and so on. And we continue to do that ongoing engagement. And you can see there, Paula Bradley, who was the deputy leader of the DUP until just a little while ago, was holding up our feminist recovery plan and saying, you know, there's a lot in this that we could be using. And that's really what the purpose of it is. It's not just to, I suppose, harangue politicians and say you aren't doing it good enough. It's to hand them a sort of blueprint of what they could be doing better. And we really hope to engage with every possible political party. And we're doing that again now in the new mandate, to say to them, here are some things that we think you would like to work on and that we would like to work on and that we're happy to work together with you on. And that includes, you know, things around new legislation, but also policy, and reminding them again and again, they've got to have women in the room when they make these plans, because too often they don't. So next slide, please.
So again, the full feminist recovery plan was sent to you, including a summary briefing as well as a supplementary report and a council specific one. So apologies for how large your packs were, because a good 500 pages of that came from me, but it really was just showing how we have been trying to break this down. So there's the huge plan itself, which is made of 6 main pillars, which covers economic justice, then health, social justice, culture, Brexit and the Bill of Rights, and then international best practice. And across almost any policy issue you can think of, we have an example of that. So whether that's to do with supporting people through things like poverty, austerity, current cost of living crisis, or if it's around accessible childcare, or if it's around what measures do we actually put in place to deal with misogyny in society. We have a whole range of recommendations in there, backed up by evidence each time. But we also published a supplementary report, and this is one I think should be specifically relevant to councils, because this is about direct lived experience from women all across Northern Ireland. And we decided to make this supplementary report and call it Putting Women's Voices at the Core, because we wanted it to have its own standalone place. And basically, these are the direct stories from over 150 women across Northern Ireland, telling us how they had been impacted. And there's 14 detailed case studies, which is some of the most harrowing reading I think that anyone will ever do. But I really do recommend that you look at it in more detail to see just the breadth of some of these issues and how in most cases they could have been prevented if someone had made a conscious decision to incorporate gender into the planning. But just to very briefly summarise before we finish up, in the quantitative research that we did, 82.1% of women said their mental health declined during the pandemic. Almost 58% said their physical health declined during the pandemic. 81.1% of women who had caring responsibilities said that these increased during the pandemic. And a lot of women since have been telling us that this has never decreased. 65.4% suffered financially during the pandemic. And we know now from new research that's about to come out from the women's sector that this has worsened dramatically again in the last year. 65.8% of rural women stated they had unstable internet connection, and this made it almost impossible to work from home, undertake homeschooling, and it's also an ongoing rural access poverty issue now as we move into this hybrid world of working. And 50% of those women who are from an ethnic minority community experienced issues in attempting to access healthcare services, primarily because even though we were in a health pandemic, if they seemed or sounded like they weren't from here, they were being questioned about their immigration status first and their health second. So that's just a very quick summary of what is a huge plan. And I'm going to hand over to Elaine, and we're just going to round up with our final key priorities ahead of the election and also ongoing now. So next slide, please.
So we put these together and sort of disseminated them among the women's sector right in the run up to the election. And obviously the election is over now, but we were asking for them, not just for people to raise these with politicians who knocked our front door, but also to carry these on into the new mandate, what we're going to be focusing on over the next number of years, however long we get a new assembly for. So examples of these include addressing the unequal distribution and the undervaluing of caring responsibilities, and implementing a childcare strategy and government-funded childcare provision. And this was particularly because again and again, people are telling us that their caring responsibilities, especially childcare, are not appreciated or taken into consideration when it came to things like working from home, when it came to things like furlough system and so on, but also because it's existed long before that. Long before the pandemic existed, women were carrying the bulk of childcare responsibilities, and we have needed a childcare strategy here for such a very, very long time. And what's most frustrating is whenever the first COVID plan came out from the Assembly, it didn't even mention childcare, not even once. And that just goes to show how little value is placed upon the childcaring role. It is essential for the whole functioning of society. That really came home to a lot of people during the pandemic, when all of a sudden they were homeschooling and working at the same time. It's always been important. It's just that a lot of it is masked by women staying home from work for a number of years while the children are small and so on. We need a childcare strategy so that happens only when it's chosen, and even with that support in case they choose not to. We talked about implementing gender pay gap legislation and creating a women's employment strategy. And that has to be, the gender pay gap legislation has to be sensitive to the fact that we have in Northern Ireland a disproportionate number of small companies with small numbers of employees, and therefore the current legislation in place in the UK, whereas employers of over 250 people have to report, that's going to include only a very small number of employers here in Northern Ireland. We need it to be, the bar to be lower, and really should be chasing that up as much as possible. And as for a women's employment strategy, that has to be sensitive to the fact that women bear the burden of childcare, particularly single women, single mothers, I mean. Addressing the gendered nature of poverty and austerity policies, particularly in the current context of this cost of living crisis. And that is, the gendered nature of poverty and austerity has been known for a very long time. No matter what society you look at, when you have austerity type of policies, they disproportionately impact on women, and even more disproportionately on single women who have children. It is, there are examples that have very clearly targeted women, such as the 2-child tax credit cap, but there are also examples that don't appear to be on the surface targeted at anyone, but the savings overwhelmingly come out of the pockets of women, because women are more likely to need certain social benefits, particularly social security benefits, I mean, particularly when their children are small, and therefore, even though it isn't necessarily designed that way, in practice it is that way. We talk about ring fence and sustainable funding for women's organisations and for women's centres. These organisations are often the ones picking up pieces after domestic abuse situations. They're the ones providing community-based education to women that happens to have childcare attached to it. They are literally life-saving for so many women, particularly the women with least job security, least family support, least, I suppose, disposable cash. They are absolute lifesavers, and we really need ring fence funding to be sitting in the Assembly every single time that goes directly to those organisations. Implement the commitment out of New Decade, New Approach, such as increasing access to IVF cycles. And this is particularly relevant for women who aren't heterosexual, so they're in a same-sex relationship and they're trying to get pregnant. It should not take it should not be so difficult. There are particular commitments that have been made. They were made at this stage 3 years ago. You know, why are we still, or 2.5, why are we still waiting? Commissioning abortion services, I understand that's going to happen soon, but, you know, really should have happened by now. And implementing robust perinatal mental health care services, including mother and baby units. We are the only part of these islands without any mother and baby units. It should not be difficult to do. It just requires the political will and a little bit of money. And we saw just in the news this week the devastating impacts that it can have on a person in mental health crisis with a small baby when they don't have that kind of support. We need to be doing better for these women because it's much more common than people realise. So next slide, please.
So actually, just on the previous slide, I just had a few points specific to the area of dairy and Strabane that I wanted to raise, if that's okay. So one of the things in particular around the government-funded childcare strategy. So again, there's been a campaign on this for over 30 years. It looks are going to implement what has been in place across England, Scotland and Wales, and there will be a responsibility on local councils to be the ones, really disseminating that information and funding. So I think it's something that while they're now in the research phase of the executive childcare strategy, there needs to be a buy-in from councils. Again, we're the only part of the UK or Ireland with no gender pay gap legislation, and in Northern Ireland, over a third of all women are considered economically inactive. And it's not because they have no contribution to our economy, it's because of caring responsibilities. In relation to poverty and austerity, the research as well from HMRC shows that 86% of austerity savings in the last decade came from women. So these are just some of the stats that are really sticking with me with this. And in terms of the women's centres, we work very closely with Women's Centre Derry, and some of the amazing work that they've been doing, particularly in supporting refugee and asylum seeker women. And if the situation's bad in Belfast, it's even worse outside of it. So really, we just wanted to highlight those issues for you. Now, finally, our last issues we wanted to raise from the Feminist Recovery Plan relate to rural access poverty and the digital divide, which I've already touched on. Healthcare waiting lists, again, just issues that are impacting everyone, and we're hoping to commission some new research on that this year about the specific gendered impact, but also the underrepresentation of women in politics, public life and peace building in Northern Ireland. And councils do have a very big role to play in this. I know for us, we've received council funding before to support community campaigners modules or women in leadership, but the funding is few and far between, and it's the sort of thing that really would help across all of the North. As well as developing the Violence Against Women and Girls strategy, RSE in schools, full Bill of Rights for Northern Ireland, introduction of the gender equality or social inclusion strategies, and finally, we have our recommendations for all public authorities, including councils, on how to put women at the heart of public consultation, ways to include them to ensure that your policies and practices are actually accessible. So that's it. There's one final slide, which I think just says thank you. But yeah, that's us finished. So thank you so much, and especially for bearing with us. I know it's a lot of information, but we do have a lot to share from what women have been telling us.
On behalf of committee, Rachel and Elaine, thank you for the comprehensive and incisive presentation, and obviously the articulation of what should be done and needs to be done in terms of around critical issues. I'm going to open it up to the floor, but I just want to acknowledge that we have been joined by Councillor Sandra Duffy and Councillor Sean Harkin online, and also by Councillor Rachel Ferguson in the chamber, and I have a number of indicated speakers. And if I could ask the first to address yourselves, and then I'll take a number of speakers and come back to yourselves. But the first councillor is Councillor Ferguson. Rachel, please.
Thank you, Rachel, and thank you, Elaine, for coming and presenting to the council. I think it's something that's really, really important, and I'm pleased that one of our members here, Maeve O'Neill, had done this motion to try and bring this issue forward. I know Elaine will know me well. We've done a number of online Facebook Lives on women's issues, and it's infuriating and how still to this day that every topic that we came up with was that there wasn't a policy in place that how it impacted women, whether it was health, whether it was childcare, whether it was day-to-day life, or whether it was, even the simplest thing as benefit system. So I think it's the work that you have done. I mean, you have put so much and paid into this. It's amazing. There's so much that we can pick out of it. I won't say I'm shocked. I will say actually I'm not shocked, but dismayed to see that so many women have experienced violence against women and girls, and to say that 80% of them have experienced it before 20. The biggest chunk being from that age group of 15 at 33%. I think to see it on paper is different from growing up and feeling it, and I think to see that the majority of women, you were getting huge, big amounts of responses there of 90% of people agreeing with the statements that you were making, shows that there is now time that we need some sort of strategy. I I'm dismayed that we're sitting in this position that where we could have a violence against girls, women and girls strategy being processed at the moment. We can't because we have no executive, so we have to do it through other means. So that's why it's great to have you here, Council, and see in what way we can try and implement this within our policies. I was pleased to see that within your stats that people have said that they do experience it in things like our leisure centres and public places. Because when we've raised this before, becoming a safe havens, putting up posters and stuff, people don't necessarily think, oh, that won't happen within a leisure centre, it won't happen within a council building, but it does. And sometimes it's great just to have that information and have staff aware of the signs of someone looking for help. So I don't really have a question because I think you have outlined a lot. You know, you have covered out everything. I was trying to think if there was anything I could highlight, and there wasn't. But I wanted to say a huge thank you to both of you because I know there's been a number of things over the last few years, whether it be spiking, whether it be pornographic images within Westminster, that you have been the sensible voices when it comes to media and talking about this issue and raising the profile and showing how simple things like relationship, sex, education within our schools is a small step to tackling this. So just my comments to that is thank you both for the work that you are doing.
Thank you.
Thank you.
Thank you.
Thanks so much.
Thank you, Rachel. Councillor Donnelly, Gary.
Well, good chair, not a member, but appreciate you letting me in. Look, first of all, I'd like to thank Rachel and Elaine for such a a comprehensive report. Unfortunately, I'm not surprised at what's been revealed here. I think there's a culture of discrimination and abuse. I would can be described as almost epidemic and systematic. It's been revealed recently that the 6 counties is one of the most dangerous places in Europe for women, with more domestic violence killings here per capita, and only matched by Romania. I think it's on like 0.43 killings per 100,000 inhabitants, 3 times that of England and Wales. There was one statistic there that sort of 83% are impacted by men's violence, and only 24% reported that to the police, and 77.4% of those who did not find it useful. Now, it is high numbers, but that doesn't surprise me. And if anybody just wanted to see, watch the Spotlight report last night, absolutely shocking, but not surprising. And I think because it was ex-police officers, it's been given a lot more credence, or people are looking into it more. The radio was full of it today, but we deal with incidents on a weekly basis where state violence against women, and maybe their children were being treated badly and they intervened and were assaulted, and nothing comes out at the end of it. But there's one thing that I would like to ask is, and that's regarding the housing selection scheme. There doesn't appear to be a mechanism. A lot of women are victims of abuse. There doesn't seem to be a mechanism within that takes it very seriously. You only get like 20 points, whereas when we look at the high ratio of deaths and serious injuries for domestic violence, is there any thoughts on that and how we go about rectifying that situation? And listen, thanks for the report again.
Thank you.
Sorry, Rachel, not to cut across you, but I'm going to take a couple of speakers of you, just maybe take a wee note, and then I'll bring these in to address the issues that people raise, if that's okay.
Yeah.
And just to acknowledge that Alderman Hussey is also in the meeting. Councillor O'Neill, Maeve.
Thanks, Chair, for letting me come on because I'm not a member of this committee. And thanks so much to Rachel and Elaine for coming and presenting today. I think it's so important, the work that you do, and thank you so much for all of that work. Like this as like both of those pieces of research are incredible bits of work, and I'm so thankful that you know, it is all down on black and white. And I think for many it might be hard to digest, but unfortunately it's a cold reality for women every day. So I think, you know, it's a really valuable piece of research. And I think the feminist recovery plan, I know you did it in partnership with lots of other agencies and women's groups, but I think you know, that was such a cutting edge piece of work, because I think, you know, from the pandemic, you know, there were so many learnings that we took, and there was an opportunity, and there still is, I think, an opportunity to rebuild society in a much fairer and more equal way, with a gendered lens, you know, through that work that you have done. And I think, you know, during the pandemic, it has been so tough on so many people, with the loss suffered and isolation and the sacrifices made. And you know, I think there was a bit of hope there for rebuilding society. However, now we have like the worst cost of living crisis that we have seen in decades. And like, you know, there's no argument that, you know, even before the pandemic, many people were suffering a cost of living crisis, but now that has just you know, it's just increased in terms of the levels of deprivation that people are facing. And I think that is a real failure of government, because, you know, who is hardest hit by poverty? It's women and children. And I think your research really highlights and signifies that, and particularly, you know, with the levels of domestic violence that you see, you know, when there's a recession or when there's an increase in poverty, domestic violence always goes up. And that's not to excuse men at all for violence against women, but it's to really shine a light on the responsibility of the state to do so much more about the deprivation and the cost of living crisis that people are living in. And I think that, you know, with that, we need to also look at state policies such as the 2-child benefit cap. You have highlighted so clearly around childcare, even free school meals, you know, for over the summer. Like, you know, this is where we're at in the year. You know, we're not in winter yet, when, you know, the real focus is going to be on fuel poverty, but free school meals over the summer, but also like increasing the level of carers allowance, I think is essential. You know, you have highlighted really well through your work and today, just about how like women, you know, they shoulder the lion's share of unpaid care work. You know, women, you know, I work in the hospital, and like the woman who I worked alongside were on the front line, then they were going home teaching their wains, the school that they had missed, and probably, you know, doing so much more than they would ever let on. And that, you know, that takes its toll. So it does. So I think, you know, I think council should endorse the feminist recovery plan. We haven't formally done that, but I think our council should. I'm not a member of this committee to propose that, but I think we really should look at the feminist recovery plan, look at how it applies to our council, and look at what steps that we can take to look at rebuilding post-COVID in a way that, you know, has a gendered lens, but in a way that actually does tackle the root causes of violence against women and girls, because that's what this is about. So thank you so much for everything you do and for coming today. Cheers.
Thank you, Maeve. Rachel and Elaine, do you want to come in at this point? I've still a number of speakers, but I'll come back to them. Do you want to?
Yeah, if I can briefly say something about housing. This is something that we covered in detail when we were talking about domestic abuse and domestic violence prevention orders, which the police are looking at piloting. It hasn't been piloted yet, but it's one of those things that housing was not specifically asked about, but we included it specifically because one of the main reasons people do not leave abusive situations until for a very long time is because there is no place for them to go, and they're way down to housing list. They don't get enough points allocated for being survivors of domestic abuse. and whatever else might be going on in their lives, that might be the only source of points that they have in some cases. So it is really essential that there is a better housing stock across the board, and there are some areas in which there is just a desperate need for housing stock, full stop. But there needs to be a sort of ring-fenced amount of housing in which we can put people who are in crisis and who need to get out of the home they are in immediately. And we suggested that as a specific building project that would, I suppose, perhaps be managed by the housing executive, but it would be separate to regular housing stock. So those houses would not eventually end up in long-term use. They would be almost like safe houses. And also that a survivor who was needing those houses would be able to have a choice as to where they would end up, because sometimes it might be, in fact, even closer to their abuser than they would otherwise be, or it might be within close range of people who have maybe relationships with that abuser and so on, so that they should be really treated very much like almost like sheltered housing, with all of the support that people might need to make that transition between going from a shelter to going to live independently, and with security, appropriate security and so on. Now, as it is, we don't have enough spaces in shelters, and we don't have enough spaces in public housing. We don't have enough houses being built. So this is a little bit of a pipe dream at the moment, but you're absolutely correct, Councillor Donnelly, that this is a cornerstone, absolutely, and this is another thing we've been pushing for. And if I'll just briefly say before I pass to Rachel, Councillor O'Neill, totally agree with your point there about the pandemic. In one way gave us a moment where we could start to reimagine society differently and better. But I suppose we wouldn't be in the line of work we're in, and indeed you wouldn't be in the line of work you're in, if you didn't think that there were ways to improve our society. And the difference is how ambitious people are willing to be. And I suppose this is a moment where we're pushing very hard for people to be ambitious, because there are changes that could be made almost across the board in just about every policy area you can think of, that could dramatically improve children's lives, and indeed along with it women's lives. Sorry, I meant women's lives, but also children's lives, men's lives, family lives, lives across the board, because there is so much that the state can do to prevent these problems happening, and there's also so much they can do to help those people who are victims. But I'll stop now and pass to Rachel.
Thank you, Elaine. So I'm just going to respond very briefly to each of the points. So first of all, to Councillor Ferguson, thank you for your comments. One thing I actually wanted to highlight, so Northern Ireland, we were the second place in the world to have a feminist recovery plan. The first place in the world was Hawaii, and it was developed by the Commission on the Status of Women in Hawaii. We were inspired by that plan, thought, we're going to do the same thing, apply it to the context of the North, particularly because we're so much further behind on social equality and gender equality issues. And the difference in how it's been perceived in Hawaii, their local councils took all the recommendations on board and started embedding them across the whole state. Here, we were primarily focusing on the assemblies at first, but in a lot of the times, it's been held up in the assembly, but nothing is happening. The political instability is what's taken hold instead. And I think there's a real opportunity for us to work with local councils, because almost every single aspect of the plan is relevant as well to your area. So just to say that, I wanted to also just comment on Councillor Donnelly's point on housing. So in the women's sector, there was a bit of work done around the consultation that was done on intimidation points, around the review of these. And I know that things halted when the assembly had collapsed, and then nobody's really sure what happened afterwards. But we were very much making the point that, recorded domestic abuse alone accounts for a fifth of all crime in Northern Ireland. There needs to be a new way that we look at securing people safe housing in this situation. It's actually an obligation on the UK government as a whole under the Istanbul Convention. But in Northern Ireland, again, you'll not be surprised, we have way less funding for refuges. We have way less funding for any form of support. There's hardly any women's refuges. A lot of them are being closed. And within our additional report on women's voices at the core, and also the Violence Against Women and Girls report, we have an anonymous story called Beth's Story. I really recommend all councillors read it, because it highlights what happens when you don't have a home to go to, and when you're put into a hostel that is not safe. So I think it's just really harrowing and something that needs to be considered. there's also a pillar within the economic justice pillar of our feminist recovery plan, focused specifically on housing as a human right, which addresses a lot of these issues. And then finally, I want to thank Councillor O'Neill for bringing this motion in the first place that enabled us to be here today. You know, we were really overjoyed the fact that someone reached out to us. We're so used to knocking the doors repeatedly. So I'm absolutely delighted that we were able to share this research with you today. And really do hope that the Feminist Recovery Plan can be formally endorsed by this council. We firmly believe that in moving beyond COVID, the reason why we called it a recovery plan was because we believe we need to realign our economy and we need to have care at the core, and that benefits absolutely everyone, not just women, but everyone. And we have made so many recommendations on around addressing, you know, things to do with cost of living, poverty, current responsibilities, low paid work, increased workers' rights, loads of recommendations on poverty, specifically on social security, practical things to help. What we're seeing coming out of the Chancellor's office does not help people on the ground suffering. So we need localised solutions to this. So just, yeah, that's brief for me anyway, a brief response to those 3 points.
Thank you, Elena and Rachel. I have 4 further speakers and then I'll come back to yourselves then. And members, also, as people will see from the chat box, we have a proposal from Councillor Harkins, seconded by Councillor Boyle, and we will address that in a short period of time. So for now, if I could ask Councillor Boyle, Michaela, please.
Thank you, Chair. And thank you, Elaine and Rachel, for the very detailed presentations today. I have to say, in all of my time in elected politics, I've never seen such a detailed piece of research and work undertaken. And I would even go as far as to say it should be implemented. Every department within government should implement that, what's contained within it. I suppose just there's a view out there that women's rights have progressed in the last few years, particularly here around the coercive control and stalking and harassment. But I do believe we've still a long way to go. It would be very foolish to believe that women and girls' rights, that we have equality here. Particularly when you look at violence and sexual harassment in the workplace and violence against women and young people. And I mean, we're underrepresented in politics as well, in public life in many sectors, as we alluded to, have significant pay gaps. But I think for me, and I read your report, and as I say, again, thank you for it. I think it was yourself, Rachel, may have said earlier, to look if there's any gaps, and maybe I didn't see it, but it's probably in there. But elder abuse as well as a major factor in life now, and we're hearing more about it, particularly coming out of the pandemic, elder abuse and financial abuse. But I suppose in my line of work, like other elected reps, in our offices, we deal with a lot of issues pertaining to women and young girls. And I'm very conscious this is about women, so don't forgive me if I know if we don't kind of talk about others today. But anyway, I suppose what I'm saying is I deal a lot with traveller women in my office, and it galls me. I mean, the access to services that they don't have, to rights that they don't have, and I suppose a lot of it is down to their culture. But I think as a society, we have to address that and support those women and the marginalised communities. I think the support that's needed for women, are often seen as the role model within families and the woman that's most likely to be at home. and juggling between work and home life. And, you know, over the course of the pandemic, we saw, you know, a lot of families coming to us looking for support for face-to-face access to services that weren't there during, you know, struggling with children who have needs, who have complex needs, who have medical needs, who have, you know, autism and issues, and looking for support of the services. And within your research as well, you focused a lot on rural issues and women in rural areas. And I suppose I represent a large rural area, and there's so many issues there facing women in terms of rural isolation, accessibility to services, education and training, and transport and childcare. And those issues, you know, whilst a lot of the community and voluntary organisations that are, you know, in some good community groups deal with the issues in the rural areas, they get piecemeal funding to deal with the education and the training and support services. I think we've a long way to go to adequately address the issues in terms of rural women and women's vulnerability, particularly in rural areas. I think the commitment to provide longer term funding to support those services in rural areas as well, that we have to, you know, to continue to develop those services and provide for women in rural areas. Education, and this is one of my fanfares. I do believe reform of education. We are never going to address any of these issues. Children, young girls and boys, they spend, if they're not at home, they're in school for the best part of the day. And you know, the curriculum's changing, societal issues are changing. I think we need to do everything we can to ensure that the curriculum is reformed, as you said in your research, to address consent, harassment, victim blaming, and dismantle the beliefs that women and girls are responsible for their own safety, and that's highlighted within your report. And I do think that's what we need to address in our schools. I do know schools go in some way holistically to address these issues when they come to the school curriculum, but I think there's a lot more we need to do in that area. I know my own party this year brought forward a private members bill in the Dáil outlining changes that the government must implement to eliminate violence against women and girls. The motion set out key policies needed to ensure such crimes against women and girls are prevented, and government need to do more, and we need to end the tolerance of gender-based violence, harassment and sexual crime against women. I mean, I know Councillor Donnelly, it would be remiss of me not to mention it. Councillor Donnelly mentioned the programme yesterday evening. We need to address workplace and sexual harassment and the misogyny within the workplace. And we saw last night in Spotlight what happened within PSNI and how we address that. You know, what do we do to address that misogynistic behaviour in a predominantly male environment workplace? You know, and it's something that we're not going to change overnight. But I do believe that there's an onus on all public sector bodies and private, but more the public sector, to address those issues. So I just, you know, I don't have specific questions, but I just, you know, there's a lot within your reports, and I do hope that those reports are out there for, you know, I'd like to hear what you are going to do with those reports and that research and where they're going, because they should be at the heart of government. And you're absolutely right, Council, there's an onus on us as a corporate body to ensure they're enshrined in everything that we do. So thank you, ladies, and I do appreciate today's meeting, and it's been very helpful for our work that we do in supporting women and young girls. Thank you.
Thank you, Michaela. If we could ask Councillor Tierney, Brian.
Thank you, Chair, for bringing me in, and thanks to Rachel and Elaine for their very detailed presentation, and having it in advance was obviously a huge benefit as well. I think if we're going to be honest, there's some very, very startling figures and statistics within the body of the report, and ones, you know, the particular one that jumped out at me was, you know, where do women mostly see that that violence against women can take place, and it was absolutely everywhere within society. There was nowhere that, when you looked at the list, there was nowhere that jumped out as a safe place for women, and all of the figures, or all of the respondents' figures were all over the 90% mark, which is absolutely frightening. There was no real place where women were going, if I am in such and such, then I'm safe. It was right across society, and I think all of us have a duty to make sure that we're doing all we can to make those places, and particularly those places where we have that bit of influence and, if you like, control over within council premises and things like that, make them a more safer place. But I think to do that, what we have to do is to make sure that the general public know the signs to look out for whenever there are violence against women taking place. I, for one, until about a year and a half, maybe 2 years ago, was unaware of it. I received a call from a constituent late at night who was asking me, would I be able to deliver a pizza to her home? I had absolutely no idea what she was talking about, and I thought she genuinely had the wrong number. My wife's a healthcare worker, and I hung up and thought that was a bit strange, wrong number, told my wife what was happening, and she was able to point out exactly why I needed to do something. But to me, that was completely alien, that person was reaching out and seeking help. And if I hadn't have mentioned that, God knows what the outcome would have been. I think whilst it's a good way for people in a violent situation to try and reach out for help, I think if the person on the other end of the phone doesn't know that they're actually calling for help, then that's a major problem. So I think making signs like that more readily available to the public, and making sure that people are aware of the signs where people are reaching out for help is certainly something that we should be looking at. We're happy, Chairman, to endorse Councillor O'Neill's proposal that we endorse the Feminist Recovery Plan. It's quite shocking that we need it, but I suppose, you know, if we're going to improve it, we have to build somewhere. So we're happy to endorse that plan. I think also, you know, Councillor Donnelly has made a very good point around the housing and the 20 points for fear of violence. Whilst yes, it may identify that there is an issue there, it doesn't give anyone who's suffering from violence or almost leaving a home due to violence, it doesn't give them that sanctuary, that peace of mind, that knowing that once they present that they will not have to, and they will have all their options there available to them around housing. I think when you look back at the most recent election campaign, the number of candidates, and I think there was a report out this morning from the Justice Minister around the number of female candidates who had received online abuse, is something that absolutely needs tackled. I think almost every candidate in the election suffered online abuse. I know it was it was on a high in the Foyle constituency this year than it had been in previous years. But I think that report that shows that the level of abuse that the female candidates had suffered is definitely on the rise right across the north. And I think that's something that we all, again, when we see it, should be calling it out, not just ignoring it and thinking, well, it's not me, so I don't need to act. I think things like that and actions like that need to be called out. And again, that's about building confidence within wider society to stand up and say, we're not accepting that, and you're wrong for doing that. Look, we're fully supportive of the work that you are doing. Absolutely, and totally endorse the Feminist Recovery Plan, and anything that officers can come up with within our own buildings to help promote what and how people should react to these signs and stuff like that. We're absolutely happy to be involved with. And thank you very much from the work that you do as a husband and a father to a young daughter. You know, I want to see these societal changes taking place. I will make one comment on the female being the, if you like, the primary caregiver as a father of 4. I don't think for all men it's intentional. It's almost rooted within your mind. My wife is the primary care at home, but it's not intentional. She works a busy job, but if the children are sick, it's mommy will take a care day, or mommy will do this appointment, or mom. It's, again, I think it's a societal change, and I think it's something that we could all, myself included, could get slightly better at. But I generally don't think it's something that males do intentionally. I think it's just our default position, if you like. But again, societal shifts is what's going to bring on the equality for women, and we're well up for that challenge. So thanks very much for your presentation. Thank you.
Thank you, Brian. I have 2 further speakers, Rachel and Elaine, and then I'll come back to yourselves. Alderman Kerrigan, Keith.
Thank you very much, Chair, for allowing me in. I do thank Rachel and Elaine for bringing forth their report, and again, getting it in advance. There's a lot of detail in it, a lot of information there to go through. It definitely was, and you know, it's one thing sitting reading it and then getting your presentation on it. You know, a lot of points I would agree with you in the report. Some points I would have a different view on wee things. You know, there's certain wee things, but it's the odd wee thing to do with tax. There's different wee things in there, but it's lots of things in there that, like I'm sure, like all the other councillors, we're all getting that touch. You know, particular gripe I had, as you touched on there, is this arbitrary 2-child limit to do with tax credits. I know everyone's moving at, they're trying to push everyone across to universal credit, which has been a proper torture. You know, whereby the tax credit system was a lot easier maneuvered, and just, I don't know why it's just been chosen 2 children, you know, but it just is that, and it's just unfair for those that, you know, and again, cares allowance, and again, I know that because, as I say, I've had the through my own work outside the council, you know, I deal with a lot of carers, and again, that's predominantly a female workforce, and again, getting even their mileage back again, and particularly during that COVID, when they all had to travel separately to their clients, to the customers, and again, you know, the additional mileage that they incurred and the additional time and this and the other. So again, I know that, and even just for those, it is the case, as Councillor Tierney there has touched upon, you know, when the Waynes are sick, and again, I know with my own 4 too, you know, it was always look to mommy. You know, daddy was all right, but it was mommy was always the one that would sort everything out in that regard. And well, that is just you know, well, it's a thing there, but it does need to change. But it was always mother was looked at to sort them out, and they always looked to mum. You know, so it is that scenario. But no, it is the case that the ladies are caught in that care. And again, you know, as touched on there in regards to the rural, again, I'm a rural councillor, and you know, the support for rural women, and it shouldn't just be left up to DAERA. Again, all the departments there have that responsibility to have an input on there. And you've touched upon cares allowance was the thing I was going to on that there. You know, the ones that are caring in the home, and there are a lot of people sick and disabilities there, and the cares allowance is really buttons compared to you know, if you had to put that loved one into a care home or something in that regard, and the cost it could incur, and yet you're asking someone, and it's not, I know the cares allowance is 35 hours a week they're meant to be doing, but the hours that people are putting in to do that, it's astronomical if you factor it in and averaged out what it is actually in a week, what people are doing, and you're giving them £69 a week. You know, it really is buttons there. So there's those factors there, and I agree with a lot of what you've got there. Again, you've touched on the thing there. I remarked through your report. it is the case, lone parent families there needing the support and for the children. But as well as that, I suppose, given the way the circumstances went and the cost of living, the working poor, you know, there are couples there. And again, they're getting it as tight, and both of them could be working part-time, both working full-time. And it is so tight for everybody out there. So, no, I welcome the report and the way that you have both put across. You know, it was good to get your detailed report, and as has been touched on, a lot of information on it and a lot of points that I was going through it. And as I say, some I was 100% behind, some of it a wee bit different viewpoint, but it is what it is. But hearing the way you have portrayed it and came across with it, it is shocking to hear some of the statistics and some of the things you've come across with. And no, it has been very much welcome that you have come into the committee and to really educate us and give us that information that we knew things weren't great, you know, but we didn't realise to the extent there. And when you've been able to put that across, it really has opened my eyes, and it's really something that we will have to see what we can do as a council to try to support the work you're at. But thank you very much, ladies, for coming in and making your presentation. Thank you, Chair.
Thank you, Keith. And Councillor Harkin. Sean, please.
Thank you, Chair, and thank you, Elaine and Rachel, for your excellent presentations and for taking the time to be here, and really for the work that's embodied in these in this document, because I know there was a tremendous amount of work by a lot of people, but it is, you know, it's very, very important, and I hope that you can see people are taking it very seriously because of how systematic the work is, and that makes it a critical document. And is, look, it was a COVID recovery plan. I think you could call it now a cost of living recovery plan. But I think, as you said in your presentation, all of these problems existed before COVID. They existed before the cost of living crisis. The problem now is that they're unfortunately going to get worse as a result of the pandemic and of cost of living, unless there's radical action taken to point society in a different direction. And that's what's important. So I think that you know, we're here to talk about violence against women, and you know, that is that everything that you've presented and that's in the document is alarming about that, and it's a call to action, right? I mean, it's shocking statistics, and it really gives you for those who don't fully appreciate it, this is what women are facing in a day-to-day way. And we need to change it. And, you know, obviously men have a big role in terms of taking responsibility for that. But we also have to look at, like, you know, what the recovery plan documents is, like, the unequal way women are treated in every walk of life. It's you know, from the systematic violence and harassment right down to, you know, caring responsibilities and pay and everything else. So I think while we have to focus and do everything we can around raising awareness, around education, there needs to be deep-seated structural change as well, because we can talk about the actions of individual people, individual men, which are abhorrent, but we also need to look at the state's role. And I think that you know, there's a tremendous amount in your document that is the flows from how the state operates, in terms of the state having policies, having legislation, having ways of doing things that actually reinforce you know, inequality for women. And so I think we have to be pushing against all of that. You know, if we want to transform things, it's going to have to be you know, deep-seated radical change. And as you said, Rachel, this is a document about a recovery plan for women, and about women's equality. But if everything in this document was realized, it would transform things for the better for the vast majority of people in society, men and women, boys and girls. You know, so that's why this is really a social justice and equality document, and it's a manifesto for, you know, for change. So I think the council should endorse it, and I'll add to the proposal that we circulate this on our council social media platforms and anywhere else. And I think we should have council officers look at it in terms of the practicalities of if there's anything in it that we can do across our council buildings in an immediate way. But I would say, look, I mean, there's so much agreement here in terms of all the political parties saying that they agree with this, they want to endorse it. So the question is, when you get that kind of level of political support, why wouldn't we see this implemented? I mean, I think that a dysfunctional Stormont is certainly part of it, but that's not the only reason. I think that, you know, there has to be an analysis as well about when we have this level of support, why don't we see these types of policies implemented? Why would people not get behind transforming our society to make the changes that are proposed in the document? So look, you know, thanks for being here today, and like People Before Profit, we will do everything we can to fight for the proposals that are included, and thanks again for being here.
Thank you, Sean. And if I could invite Rachel and Elaine, in terms of the comments and the inputs that they've heard. Thank you.
Yeah, if you're happy enough, Elaine, I'll just go first and then hand over to you. I might work backwards because it's not specialist in my head. I was taking a lot of notes. So, Councillor Harkin, thank you very much for your comments. And this is the one thing with the plan we really tried to highlight. Yes, it's radical, but it transforms society for absolutely everyone. You know, we have highlighted these societal issues that exist through a gendered lens. This is how women are being disproportionately impacted. But throughout all of our recommendations, we've shown ways that men, boys, everyone will benefit from these changes, particularly if you look at the economic justice pillar in relation to care and responsibilities. You know, we're calling for a lot of things to improve men's working conditions and their ability to address the unequal distribution of care and responsibilities within their home, other things in relation to health, even the benefit system. Like, it makes no sense in Northern Ireland that we are not recording the gender of people on universal credit. It's such a new benefit. Why would we not be recording that? Equally, we don't record the gender of people that are made redundant, which also makes no sense because we know anecdotally it was primarily women throughout the pandemic. But all of these things really are to address the structural systemic inequality that women face across every walk of life, but then very practical ways to alleviate this, or address, or not even mitigate, but fully wipe out this inequality and benefit everyone in our society. And, you know, we have had a lot of support in the Assembly for the plan, but and from every single party in the executive and others on outside the executive. You know, members from each party have supported our plan or stood up and paid lip service to it in the Assembly. But what we're failing to see happen then is actually any change on the back of it, as this political instability takes over. And for us, we're really refocusing now, and we're going to be looking to councils as a way to try and alleviate against that political instability. So some of the other things as well that I just wanted to mention really, really quickly. So in relation to some of the issues around rural women in particular, this is an issue we've been highlighting over and over again. Rural women account for 40% of women in Northern Ireland, but they get only 1.3% of the government funding that goes to all women. It makes absolutely no sense. Myself and Elaine are both from rural areas. We might be based in Belfast now, but you know, the digital divide, rural access poverty, the issues that rural women are facing are so exacerbated compared to those living in cities in a lot of cases. And there's one case study in the Violence Against Women and Girls report where a woman talks about, or there's a story about a woman who lived on a farm with an abusive husband who kept threatening to kill her. But that if he did kill her, he'd be able to pretend it was a farming accident, and she had nowhere to go and no support, and she had no income because he controlled it all. And that is unfortunately a reality for way too many women in our society, and it is everywhere, and it needs to be dealt with. For the working poor as well, you know, this is an issue that we know that almost 70% of people on universal credit are already working. So this whole thing, you know, the best way out of poverty is working, is just nonsense. We need to start challenging these economic models that are being presented to us because clearly they aren't working. And our recommendation is to put care at the core of our economy, fundamentally, and everyone else will benefit and every other sector will benefit. Some of the other areas as well around online abuse that I wanted to just mention really quickly, because I know Elaine will probably have more to say about the resources on this. We fully support, oh, sorry, I think I was frozen there. We fully support the recommendations coming out from the Justice Minister today, but this is something we've been highlighting as an issue for women in general. You know, myself and Elaine, every time we do a presentation like this or an interview on the radio, are inundated with abuse and threats. It's any woman in public life who's challenging the norm is getting this. It is a deeply systemic issue, and it's been normalized and primarily, it is undertaken mostly by men, but also those defending women tend to be women. We need others to be stepping up here. And we have been calling for real legislative change on this. And I think it's really apparent from all of the different stats across all of our work why these changes are needed. And we've broken it down now, what's needed at the council level, what's needed at the assembly. And in relation to care and responsibilities, I just wanted to say, we fully support women who choose to stay at home and undertake care and responsibilities. We're not saying that women need to be in the formal labour market. We're saying that we need to actually recognise their economic contribution. Before the pandemic, Carers NI estimated that unpaid carers saved our economy $4 billion a year. $4 billion. That is primarily unpaid domestic labour by women. Yet, at the same time, all of our economic statisticians say that a third of all women are economically inactive. I'm sorry, but they are active. They're upholding our communities. They are running their family homes. And without them doing that, our society wouldn't survive. But the important thing is that most women don't have a choice. And we should be giving women a choice, whether they choose to stay at home and be a stay-at-home mom or care responsibilities for their family, or choose to go to work. And at the moment, because women are overrepresented in low-paid part-time work, they're the ones that have to give up work because they can't afford the childcare. Because we have the second most expensive childcare in the world in Northern Ireland. So it's just clear that as other issues have dominated our assembly and different discussions around whatever political crisis comes up that week, these issues have been getting worse in the background for decades. So we're really calling out, these are all the issues at hand, and here's what needs to happen. And there are other areas that we want to work more on. We've started doing some work with older women, particularly across some of the women's centres. I've started doing some outreach with traveller women. It's something that I've been trying to get reflected in our stats, but we really need to start working, dedicated to that. So I'll hand over to Elaine for any other comments that you would have.
Yes, thank you, Rachel. I'm going to try and be brief because Rachel has covered so much, but there's a couple of things that people have said that really stood out to me. One of them was the mention of sort of elder abuse and older women. Older women are, of course, also much more likely to be in poverty than older men in their years as a pensioner, because they've earned less during their lives. And it just demonstrates again that interconnectedness of everything. These are systems that interlock. They aren't separate things. It isn't a coincidence. And I think we need to train ourselves as individuals and as institutions to stop seeing each problem as just something just popped up overnight like a mushroom. They're all connected. It's a systemic kind of thing. That's just in relation to what Councillor Boyle had mentioned there. But Councillor Tierney mentioned something that struck him was nowhere seems to be a safe place. That is something that is really hard to I suppose, stomach. And it's something that we would hope people would take as a rallying cry, a really kind of a red line. We cannot tolerate this anymore. We've got to do better by our communities, by the women that we know and love, but also by the entire community. Because we don't want to be the keepers, I suppose, of a society in which that's acceptable and that's normal. In many ways, it's not getting worse. Although I totally agree with your call for better education about what do you do when somebody reports to you or discloses to you that something's happened to them, because it's not something that's really covered. It certainly could be covered within a school's context, RSE and so on. But many of us are long past the school age. Certainly I am. And, we still need that information. We still need that education. So I think public awareness campaigns, and that's the kind of thing that could be, to some degree, run locally, but really ideally should be run directly centrally from Department for Health, Department for Justice, that kind of thing. And we're calling for similar public awareness campaigns around issues like consent to catch adults as well. One other thing I will mention is online abuse of politicians and candidates who stood in this election, and also physical in real time abuse. There was a candidate here in Belfast who was physically assaulted while canvassing. That's just wildly unacceptable, very obviously, but it's particularly women who got this kind of abuse. And I again fully support what the Justice Minister has said today, but we need to do something much more than something that looks at politicians. Like Rachel said, it's all women in public life, and it limits girls and women's choices. It limits how often and how loudly you speak. not literally how loudly you speak, but you know how willing you are to put yourself out there. We have with Raise Your Voice, we have a lot of training that's available, and some of it is stuff that men can do, skills men can learn to step up and be an ally and be a bystander and know how to help in the moment where you see something happening. So I'll send on details of those, if that's all right, to use after this. The one other thing I will say on what Councillor Tierney said, and also Alderman Kerrigan mentioned similar stuff about ways in which maybe we as individuals could be improving, men in particular could be improving the way in which they, for example, see caring and so on. The way I see these problems is there's a lot that we can do as individuals. There's a lot we can do as organizations and communities, and there's even more we can do as the state. And the state ultimately is where the buck stops. And that goes to what Councillor Harkin was saying. We really do need deep-seated, dramatic change, but the state's role is pivotal to everything, every single thing. And when you look at, for example, pension poverty as an example, that goes back to the way in which women were treated in work, not getting enough stamps because you're having babies or staying at home looking after them. Well, too bad you don't get a good enough pension. You know, all of these kinds of things are interconnected, even if they don't seem like they are. And going to austerity, which we mentioned repeatedly, and what a blight that is on women's lives. The UN rapporteur on extreme poverty did an examination of the UK as a whole and their austerity policies. I've actually looked it up to make sure I get his words exactly right. They said that our welfare system is so sexist, it may as well have been compiled by a group of misogynists in a room together. Like that is damning. And I know the reaction was very much to be quite defensive of that system by the government, but which you would expect. But, you know, stepping several steps back and being as you are, people within the community who constituents, they come to your door, they, you know, send you the emails and all of that. You see just how bad this is. So I suppose it's time to take on what you can at council level to push it up the hill to your parties if and when they are represented at Stormont or anywhere else that they might be represented, be it Westminster or Dáil Éireann or anywhere else, and ask them to really carry the part of the weight that they can as state institutions. And yes, it is a really radical plan, but you do need a radical plan and you need radical hope to be able to actually try and build the society that we all deserve. And that's all of us, men, women, children, and those who fall in between. We can do better, really, and we really hope that this is a kind of a blueprint for that. So thanks so much. And also thanks to Councillor Ferguson, who's been so fantastic for a period of years. We've worked on a number of different things and, you know, public awareness things, and she's been fantastic. And I forgot to mention that earlier. So thank you.
On behalf of the committee, Elaine and Rachel, can we thank you for the presentation and much more of the work behind it. And obviously, as you rightly say, in your submission, these things have to be brought to bear by governance and by councils, and they can't be taken and seen as a good idea. They have to be, in a sense, implemented to make meaningful change to people's lives. So, as I say, on behalf of the committee, I want to sincerely thank both of you for today. And as I say, we're going to move on with the rest of the meeting, and you are more than welcome to join us on YouTube. But for now, we say thanks to both of you. Thank you. Okay, members, we have a proposal that was proposed and seconded that Council endorse the Feminist Recovery Plan. So I'm going to give people a minute or two if they want to indicate their support or otherwise. Alderman Kerrigan, Keith, thanks for that. Folks, it might just be an idea they take a vote on this, so just so we're clear. So as I say, the proposal is council endorse a feminist recovery plan, and I'm going to ask Karen to just go through a vote with us in relation to this.
Okay, thank you, Chair. So Alderman Devaney,
Abstain.
Alderman Guy. It's gone. Oh, I'm too squeaky, sorry. He's gone. Alderman Kerrigan,
Abstain, Karen.
Councillor Michaela Boyle,
Or Karen?
Councillor Carr, in attendance, Councillor Duffy,
Or
Councillor Edwards, don't think he's in attendance. Councillor Farrell,
For.
Councillor Ferguson,
For Karen.
Councillor Fleming,
Or Karen.
Councillor Harkin,
For.
Councillor McGinley, just go on. Councillor Snowy Barr, don't think he's in attendance, and Councillor Tierney.
For.
7 for and 2 against. Chair.
Thanking you, Karen, and thanking you.
Sorry, abstention, sorry.
Thank you, Karen, and thanks, members. The motion is carried. Members, with regard to our second presentation, which was, as you know, to be from the Commissioner for Children and Young People, Commissioner Kula Yusama. She had put a message in the chat box to say that she had to go on and couldn't fulfill the engagement. So hopefully we can rearrange that engagement for another time. And just to say as well, that were mentioned there, chairperson's business, there is no chairperson's business. So thank you for today's meeting, and thanks to the officers and the AT. Thank you.
Thank you, Chair.
thank you, Chair.